University of Ottawa epidemiologist Raywat Deonandan. Good afternoon, and thanks for joining us.
Good afternoon. How are you?
We're doing well. 2/3 of Manitoba's 52 COVID-19 cases today among unvaccinated people. The numbers really shine through on this, don't they? The fact that this is a pandemic now of the unvaccinated.
It totally is. I'm not sure why people aren't getting that yet. And I guess they're confused by the fact that some vaccinated people are still becoming infected. But that's not unsurprising. Vaccines in general, most vaccines don't prevent infection. This one prevents some infection. It's just that some will get through. So don't let that bother you. Look at the hospitalization numbers. Look at the serious symptom numbers. That's what matters here. And overwhelmingly, vaccinated people are not ending up in the hospital or having serious symptoms. In Manitoba, none of the new hospitalizations are amongst vaccinated people. That's a take-home message.
Some great memes out there really explaining how, in very simple terms, the vaccine does not put a force field around you for preventing you from getting sick. We don't see people getting maybe the chicken pox or smallpox or measles, mumps, rubella because everybody else has it, so there's just no place for it to circulate. But when we are now looking at studies from Angus Reid today, it looks like the vaccinated are starting to get a little testy, saying, listen, if I'm vaccinated and I need help in a hospital, I should get priority over those who are unvaccinated. Does it surprise you that the vaccinated people are starting to say, okay, I'm tired of having my surgery or my treatment put off because you're not getting the shot?
Does not surprise me. It surprised me it took this long to have that attitude. And by the way, I'm not in favor of this attitude. I don't think we should be fomenting anger in the population. But it's useful, though, if the unvaccinated realize that there's discontentment with that behavior. But I don't want to suggest that the unvaccinated people not be eligible for service and care. They must remain eligible. But yeah, people are upset. And I think peer pressure is going to play a big role now in compelling those last few holdouts to accept the jab.
Agree with you entirely on that point. Raywat Deonandan is with us from the University of Ottawa. Richard and Julie with you on 680 CJOB. Interested in your thoughts as our children go back to school, the ones 12 and under going back, the vulnerability of this group, given what's going on in the United States. And we're seeing hospitalization of some children, even in those areas where you do have pretty good vaccine take-up. Is that a coming attractions to what may happen here in Canada, Raywat?
Oh, man, I hope not. I hope that's not the case. We just don't know. There's so many unknowns here. Vaccine uptake is one big factor. Also, behavior is another one. Are these children engaging in other extracurricular activities that expose them to infection? What are the conditions in the schools? Is there a masking mandate? Are the teachers vaccinated? Are students discouraged from interacting physically too much? A lot of unknowns here. I think in Canada, we take this quite seriously, and so I don't expect it to be as bad as the USA. But we're going to see a spike in infections in children, and we're probably going to see some hospitalizations. I'm hoping it's not too bad. And maybe, knock on wood, we can avoid deaths. But that's always possible unless we can really ratchet up vaccination amongst everybody else quickly.
I agree. There's mask mandates, etc. Most schools are really clamping down on that. What are you seeing from the numbers in other provinces? We're still low here in Manitoba, but we're getting our cues here from Ontario, Quebec, Alberta and Saskatchewan. Any children there getting sick?
Not that I'm aware of. There are some infections in children happening, but nothing that's making the news or a signal of hospitalizations that is worrying yet. If we do see something, it'll probably be happening in Alberta, where most of the COVID tragedy or explosion is happening in this country right now. Quebec is an inspiring situation where the premier is pushing the vaccine mandate hard and compelling healthcare workers to be vaccinated and introducing the vaccine passport in a variety of creative ways. Ontario will follow suit very soon. So the answer is I don't know yet. And we just cross our fingers and hope that important things happen. I'm really hoping that the rapid testing tool becomes more widely in use. It's being used in private schools across Ontario. I want to see it being used in public schools as well. Keep infected students out for that day, and we can really minimize the probability of a spread happening in schools.
A researcher will join us from Children's Hospital here in Winnipeg on how your teen can be a part of the solution. That's in about 8 minutes. Jules?
And here in Manitoba, we do have the healthcare professionals compelled to get their vaccines. school staff are, of course, kids under the, that 11 and up are eligible, not required by most schools in the city, but again, hoping that will happen. And we've seen our vaccine passport QR code come back, as have the mask mandates. Do you think Manitoba has done enough soon enough to either stem the tide of a fourth wave or prevent it entirely?
I think you've done a lot to stem the tide, absolutely. I'm pretty impressed by the speed of action that Manitoba took and the degree of action, too. Whether it will prevent a fourth wave, that's anyone's guess. A lot of unknowns still happening, like restrictions on travel, that's unknown. But I think all the appropriate things have been done, minus the deployment of rapid tests and ventilation controls in super spreading opportunity areas like schools. But everything else looks great is not the word I'd use, but inspiring is the word I'd use. I wish the rest of the country moved as quickly as Manitoba.
Are you comfortable with the large-scale events with double vaccinated individuals? As many of us watch the Labor Day Classic, as it's called here in Manitoba, from Mosaic Stadium in Saskatchewan, I was cringing because they do not have a double vaccination requirement yet. They will now in Saskatchewan. It has been in place since large sporting events and concerts have been up and running in Manitoba. Are you comfortable, with 30,000 people, particularly outdoors, if they are double vaccinated?
If they're outdoors, double vaccinated, masked, and there are some other plans in place, like some good spacing, I am actually comfortable with that. I think the probability of something bad happening is low. Never zero, but low.
Raywat Deonandan, appreciate the time. Thanks so very much for joining us, as always.
Thank you.